Here's how stepping laterally onto a slant board improves power. What's up, guys? My name is Dr. Brian Larish, and I'm the owner of Performance Redefined, a cash-based physical therapy clinic, as well as the creator of the PT Growth Academy. The Academy's mission and goal is to raise the standards in the physical therapy profession. Now, in today's video, we are discussing how you can use a slant board and how you can step laterally onto that slant board to improve your patient's power. By the end of the video, you will understand how the body produces power, the number one problem as to why so many patients struggle with it, and an example and a demonstration of how we can start to implement the slant board. With that said, let's jump in and get started. So it's really challenging to confidently coach movement if we don't understand the why. So before we talk about the how, the slant board, the exercise, power, we need to take a step back and understand the why. I find that in the physical therapy world, a lot of us want to jump to the how, but don't really truly understand the why, and then we don't get the results that we're looking for. So let's start with the first basic question. How does our bodies, how does the human being find and produce power? It's through internal rotation. So every time I say internal rotation, I want you to think of power. They're synonymous terms. Let's use the pelvis to understand when and where internal rotation is occurring. When we turn towards a side, such as walking or running or any sort of exercise, the side that we are turning towards, in this case, the right, this is biased into internal rotation, whereas the left side is external rotation. And as we take a step or change our exercise towards the other one, we're going to see this shift towards internal rotation on the left and external rotation on the right. Now, here's the thing. If you have a patient that is dealing with some sort of pain, it's probably because they're producing power in the wrong way. And a lot of times it's at the pelvis. So many patients can get into internal rotation on one side, but they really struggle to reciprocate it in the correct manner on the other. If they can't reciprocate it on the other side, instead of that, they get into their internal rotation on one side, and it's a little bit more of a lateral deviation. When this happens, we have to start compensating down and or up the chain. So the number one problem when it comes to internal rotation is that a lot of our patients aren't in a position that allows them to actually find the range of motion needed to then produce power. Remember, I just said power, so that's internal rotation. What I mean is that they need to be able to shift back to then push forward. Putting force into the ground, and force is power. So this is where the slant board comes in handy and is a great way to start to introduce this. Why? The slant board is going to help us and provide references and feedback and positions to really start to turn the body. With that being said, let's go through how the slant board works and how you can get your patients moving better. The first step in identifying internal rotation limitations actually starts with your assessment. So there's a couple key patterns that we need to be aware of, so that way once we see how their normal range of motion is, we then know what side we really want to bias and work on when it comes to the slant board exercise. So grab a pen, grab a piece of paper, use your phone, jot these key terms down. What you're going to find is that when someone has a straight leg raise on one side that is greater than a straight leg raise on the other side, in conjunction with hip internal rotation greater on one side compared to the other side, that person is probably going to be internally rotated and slightly turned towards the side that has the normal straight leg raise and normal internal rotation. They usually will lack just the opposite. So we'll see hip flexion measures slightly more limited and external rotation measures slightly more limited compared to the other side. So you start to see these coupled paired motions of internal rotation. There's a couple more, but for this video's purpose, I just want you to think about these 4 things. A recap: you have hip flexion, hip external rotation, internal rotation, and a straight leg raise. The side that most patients are going to be slightly turned towards, meaning that they're going to have an easier time shifting into, you'll see higher degrees of straight leg raises, higher degrees of internal rotation on that side. On the opposite side, you'll see higher degrees of hip flexion, higher degrees of hip external rotation. Now let's grab the pelvis and talk through what that shift looks like. So now we have the pelvis, and let's walk through an example before we jump on the slant board. Let's say that the assessment had the following range of motion. On the right side, we had more hip internal rotation and active straight leg raise. So that means we had less of that on the left. Conversely, we had more hip flexion on the left side and hip external rotation. This would start to indicate that this person is slightly turning towards the right. Why? The higher amounts of internal rotation and straight leg raise compared to the other side. Now, what does that mean when it comes to shifting and finding power? Well, remember, if we are slightly turned towards the left, a lot of people then struggle to appropriately reciprocate that to the left. We're stuck in the right, it's hard to go left. So an easy way we can do it is, instead of turning and rotating and producing power, like we should, we can do lots of things. We can stay over here and laterally bend, laterally deviate. We can get the femur to start doing all sorts of crazy things. And this is directly responsible because this side on the left doesn't want to open up. What it should look like from behind is an opening as we rotate to the left, and then a closing as we rotate to the right, and an opening and a closing. But if this is held together through muscles more concentrically oriented, tighter muscles, then we don't get that reciprocation and we have to start to compensate. Now, why is this important? Because we need to be able to get into this lengthened position back here to then produce power, to generate force. So if we can't get in the position that actually then tells our body to produce force, we're not going to be very good at it. Now, with that said, with this example that we're talking about, as we go on the slant board, we're going to want to bias the left side to open up and expand. The expansion is so that we can start to turn the body, start opening this posterior outlet up. That way we can then produce power efficiently. So now we have our slant board, and our overall goal is to turn the pelvis forward on the right and backwards on the left. Now, if your assessment showed the opposite, then go ahead, work the opposite. But we're just going to think about that for this video's purpose. So what we're thinking is we're going to step laterally onto the slant board with the left foot, and then we're going to want to turn. Here's what I want you to do. I want you to tell your patient to think about their elbow going in front of the left knee and their right leg going behind the left knee. What we're doing is we are putting our patient's body in a position that requires them to twist through the trunk, through the pelvis, and twist in a way that is biasing left hip internal rotation. Not to mention, we're going to challenge their balance and all sorts of other stuff. So when you put it together, we take a step. They're going to shift over, find body weight on that left side. Elbow goes to knee, knee behind knee. You really want to ensure that there's this massive twist going on, almost like you're twisting a towel. The more you twist, the more stable it's going to be. So as we go through it, we're going to find those positions here, find that balance, and then step off. And then step back on, find it, and back off. So this is a lateral skater where we're trying to bias internal rotation. Now what you want to do is you want to cue your patient to make sure they feel that left glute. So they may have to stay here for a little bit until they find that glute. They may have to get here, keep the foot slightly down, and really work on bringing this right pocket forward to induce more of a shift. This is fine too. If they are trying to do it and they are all over the place from a balance standpoint, they can bring their foot down. You could add a stick, anything that's going to give them the balance. But the key is now take this right pocket, move it forward. The second I do that, I feel that left glute. Again, the goal here is lengthening that overly compressed tissue on the left posterior outlet, so that way we can actually move into a position to produce power. Now we can take it one step further once they're familiar with that and actually produce power out of it. So we can step in, find that motion, and then really push on out. And they can swing and push. The pushing into the ground, the force into the ground is the internal rotation. So once they have the space, utilize it. Go through these motions and really find it and produce power out. Start to increase the speed, start to increase the intensity, but that's an easy drill that we can start to find internal rotation positions and then produce internal rotation to create force and power. So the key points here are, first, always make sure you understand the why. Why is the person moving the way that they are? Next, utilize your assessment to start to recognize patterns. In this example, we're talking about internal rotation deficits on one side compared to the other. Start to indicate how this person is actually turning. From there, use those specific findings to incorporate into your exercises. In the example we talked about, we had a right shift. We started to bias towards the left. The whole point of the bias was to open up the posterior outlet so we can produce more internal rotation. Now, it's not just produce internal rotation, it's produce internal rotation in the right way. Remember, our patients are in front of us because they're not doing something in the right way. A lot of times, they can't produce power in the right way, and something up or down the chain starts to tell them. So hopefully this will help you out and you will feel more confident coaching movement.